Hey, lovely viewers. Today, we're delving into a topic that's close to our hearts: anxiety attacks versus panic attacks. It's like deciphering the difference between two superheroes with similar powers. Understanding this can be a game changer for you or someone you care about. So stick around because we're about to break it down. Before we start, please hit the subscribe button. Thanks. All right, let's kick things off with some definitions, but don't worry, we're keeping it super relatable. Anxiety attack. Imagine this: you're prepping for a big job interview, and your heart starts doing the cha-cha, your palms turn into mini waterfalls, and your mind is playing a million what-ifs. That's an anxiety attack, folks. It's like your brain throwing a mini party when it senses a threat, usually triggered by specific situations. Panic attack. Now, picture this: you're chilling on the couch, Netflix and chilling, when suddenly, boom, your heart is doing the Macarena, you can't catch your breath, and you feel like you're in a parallel universe. That's a panic attack, and it loves to surprise you out of nowhere. Now let's get into the nitty-gritty: how to tell these two apart, with a little help from our superhero analogy. Triggers. Anxiety attack. Think of it as Batman. It's got a trigger, like a bat signal lighting up the night. Panic attack. This one's more like the Flash, lightning fast, and hits without a clear signal. Intensity. Anxiety attack. It's like a gentle wave building at the beach. Panic attack. This is a full-on tsunami of terror, quick and intense. Duration. Anxiety attack hangs around like a persistent cloud, sometimes for hours. Panic attack. It's the firework of the superhero world, explosive but short-lived. Physical symptoms. Anxiety attack. Picture Spider-Man's web. It's there but not overpowering. Panic attack. This is Hulk-level stuff with chest pain and the feeling of impending doom. Mental state. Anxiety attack. You're like Sherlock Holmes, aware of what's bugging you. Panic attack. It's more like Doctor Strange, where reality gets a bit, well, strange. But hold on, folks, here's the twist. Both of these superheroes share some common moves, like a rapid heart rate, shortness of breath, and that creepy sense of dread. So sometimes they're like cousins you can't tell apart. Let's make this even clearer with examples. Anxiety attack example. Imagine you're about to give a big speech. Your heart races, you're sweating buckets, but you know it's the speech causing it. Once it's over, you start to chill. Panic attack example. Now, picture you're binge watching your favorite show and boom. Your heart's in a race, you can't catch a breath, and you feel like the world's ending. There's no villain to blame, it just happened. Now, the big question: how do you handle these superhero showdowns? Here are some real-life tips. Breathing exercises. When anxiety or panic strikes, take a deep breath. In for 4 counts, hold for 4, and out for 6. It's like your superhero cape for calming down. Grounding techniques. Use the 5 to 4 3 to 2 1 method. 5 things you see, 4 things you touch, 3 things you hear, 2 things you smell, and 1 thing you taste. It brings you back to earth. Mindfulness and meditation. Train your mind like a Jedi with daily mindfulness and meditation to reduce overall anxiety. Seek professional help. If these attacks are regular villains in your life, reach out to a therapist. They're like superhero trainers, teaching you how to handle these battles. Medication. Sometimes you might need medication. Talk to a healthcare pro if that's the case. So, there you have it, the epic showdown between anxiety attacks and panic attacks. Understanding the difference is like having your own superhero guide in the world of mental health. If you found this video as entertaining as a blockbuster movie, smash that like button and consider subscribing for more mental health insights. Take care, be your own hero, and remember, you're not alone in this superhero journey.